Good afternoon. It's Lydia Castleman, and today I'll be speaking with you about the feminist theory. I hope that by the end of these slides that you will have a better understanding of the feminist theory. First, I would like for you to think about something. What is it that you think about or that you believe that the feminist theory is about? And the reason that I ask this is because I had misconceptions about this theory prior to studying it, and now I feel very differently about it. I believe that these misconceptions are common, and that misconception would be that this theory is strictly about gender. That is absolutely not the case. This theory goes far beyond gender considerations. Feminist counseling is built on a premise that is essential to consider social, cultural, and political context, which contributes to a person's problems in order to understand the person. When looking at the development of the feminist theory, it's interesting because no single individual can be identified as the founder of this approach. Actually, there are numerous people that contributed to the feminist theory. One of them being Dr. Jean Baker Miller. Dr. Miller was born in 1928 and died in 2006. She was a clinical professor of psychiatry at Boston University School of Medicine and the director of the Baker Miller Training Institute at the Stone Center, Wellesley College. She has been an author of several books, one of them being, as you can see on the screen, Toward a New Psychology of Women. Now, I thought that this may be a book that I put the picture on here because I thought that this may be a book that you would like to go pick up and read. Could be beneficial for all of us. Dr. Miller collaborated with colleagues on the development of the relational cultural theory. She made important contributions to this theory. One of her quotes that I enjoyed is also on the screen. They can use their abilities to support each other, they being women, even as they develop more effective and appropriate ways of dealing with power. Women do not need to diminish other women. They need the power to advance their own development, but they do not need the power to limit the development of others. Something interesting that I found out about Dr. Miller was that at an early age, she was inspired by two women nurses who helped her during her 2-time weekly appointments for polio. Dr. Caroline Zerb Enns is another contributor to the feminist theory. Dr. Enns is a professor of psychology and participant in the Women's Studies and Ethnic Studies program at Cornell College. She completed her PhD in counseling psychology at the University of California, Santa Barbara. Her most recent efforts are directed toward articulating the importance of multicultural feminist therapy. She explores the practice of feminist therapy around the world, especially in Japan. She also has contributed with several books, one of them being on the screen, Feminist Theories and Feminist Psychotherapies. In 2016, Dr. Enns was at the commencement ceremony at Cornell College, and she received an unexpected honor. She was the recipient of the Exemplary Teacher Award. Next, Dr. Aliva M. Espin, who was a native of Cuba. She actually did her undergraduate work in psychology at the Universidad de Costa Rica, and then went to the University of Florida where she received her PhD, specializing in counseling and therapy with women of different cultures and in Latin American studies. She is now a professor emerita in the Department of Women's Studies at San Diego State University and at the California School of Professional Psychology. She is a pioneer in the theory and practice of feminist therapy with women from different cultural backgrounds and has done extensive research in this area. She has published several books. One that she co-authored is on the screen, Feminist Reflections on Growth and Transformation. Something interesting that I found out about Dr. Espin is that at the age of 7, she began writing poetry. And actually, some of her poetry has been published. Dr. Laura Brown is the last contributor to the feminist theory that we'll discuss today. Something I found very interesting about Dr. Brown is that she actually received her PhD in clinical psychology in 1977 from a place that's very close to us, Southern Illinois University at Carbondale. Dr. Brown is also a founding member of the Feminist Therapy Institute, an organization which is dedicated to the support of feminist therapy. She has written several books which are considered core to the feminist practice, one of them being on the screen, Feminist Therapy, the other being Subversive Dialogues, Theory, and Feminist Therapy. Dr. Brown now is contributing to thinking about ethics and boundaries and the complexities of ethical practice in small communities. Her current interests include forensic psychology and the application of feminist principles to the treatment of trauma survivors. One of the favorite quotes that I read from Dr. Brown is on the screen. I think the challenges are to keep renewing our understanding of what feminism is, to keep expanding it so that we understand oppression and empowerment in new ways, that we don't keep on having the same definition of feminism as we did 30 years ago. Something that I thought was really cool about Dr. Brown is at the age of 64, which I can't even imagine doing this at my age of 40, but at the age of 64, she took up Aikido and earned her black belt. As you can see, there are many feminist therapists who were part of collaborating together to develop this theory. They all had the same vision, which was to improve the mental health of women. There were two waves to the beginning of this theory. The first wave was in the late 1800s. This was not the most prominent wave, however. So some of the things that were going on in the U.S. during the late 1800s were that Utah had become the 45th state. There was the Yukon Gold Rush. Aspirin was being invented. The radio was now in homes. Moving pictures. The first modern Olympic Games. And the first Coca-Cola bottle was sold. Now, the second wave towards feminism actually laid the foundation for the development of feminist therapy. This second wave was during the 1960s, which just so happened to also be during the women's movements. During this time, numerous women had began uniting their voices about their dissatisfaction with the current role of the female. They developed a sisterhood together, and it evolved into a collaboration of ways that they could improve society. Some of the ways that they wanted to improve society was to include shelters for battered women, rape crisis centers, women's health and reproductive health centers. And during the 1960s, some of the things that were going on, Lieutenant Walsh and Jacques Piccard descended to the bottom of the Mariana Trench in a submarine. I thought that was amazing. The first ever televised debate between Richard Nixon and John F. Kennedy was aired, and there were over 70 million viewers. Ben-Hur received the Oscar for the best movie. To Kill a Mockingbird was a bestseller book. Some of the favorite TV shows out were Leave It to Beaver, Flintstones, and Perry Mason. And to be honest, I still watch all three of those today. Minimum wage was $1. A gallon of gas was 3 cents. A 6-pack of Budweiser was 99 cents. And the birth control pill was approved. Now, after the 1960s, feminist therapists began to examine the relationship of feminist therapy and psychotherapy. They integrated these two. And actually, they identified themselves at this time as psychoanalytic feminist therapists or as Adlerian feminist counselors. Then by the 1980s, feminist therapy had changed dramatically. It became more focused on specific problems such as body image, abusive relationships, eating disorders, incest, and other forms of sexual abuse. And now, feminist theories have an overlapping perspective. Feminist therapists, which can be both male and female, believe that understanding and confronting gender role stereotypes and power are central to therapeutic practice, and that addressing a client's problems requires adopting a socio-cultural perspective. Basically, understanding the impact that society and culture have on clients' lives. There are 4 main concepts of the feminist theory. The first being gender-fair approaches, then flexible multicultural perspective, interactionist, and last, the lifespan perspective. Gender-fair approaches basically are just the differences in behavior of women and men in terms of the socialization process rather than on the basis of our innate natures, which avoids dichotomized stereotypes in social roles and interpersonal behavior. Flexible multicultural perspective is concepts and strategies that apply equally to individuals and groups regardless of their age, race, culture, gender, ability, class, or sexual orientation. An interactionist view contains concepts specific to the thinking, feeling, and behaving dimensions of human experience and the accounts for contextual and environmental factors. And then the lifespan perspective basically assumes that human development is a process throughout life, and that the personality of humans and their behavior changes can occur at any time rather than being just fixed during early childhood. Now we're to the principles of feminist therapy. First is that the personal is political. This is the idea that a person or individual that has problems that they have experienced, that they are often originated from political or social context, and that acknowledgement of the political and societal impact on individuals' lives is core to the feminist theory. Next is commitment to social change. So this is the idea that feminist therapists are not only look at an individual's change, but also in society's change. So this is a therapist would want to have direct action in society. So it could be that they are involved in changes of rape victims or battered women or children that have been victims of domestic violence. Whatever is important to that particular therapist, that they are involved in making changes in society for these things that are important to them. The goal is to advance a different vision in society organizations that will free both men and women from the constraints that is imposed on them for gender role and social class related expectations. Next on the screen, I have women's experiences are honored. Please understand that this is not just about women. It is actually also about the voices of any individual who has experienced marginalization and oppression, that those voices should be valued and honored. If they were no longer ignored but listened to, that their ideas, their knowledge, and their sources could be invaluable to society, and that they could make changes in society. The counseling relationship is egalitarian. So this is that there is an attention to power that is central to feminist therapy. It is marked by authenticity, mutuality, and respect, and it is core to this theory. Feminist therapists are able to recognize that there's a shift in power, or I'm sorry, that they want a shift in power, so that there is an imbalance in power between the therapist and the client, but they want a shift so that there's a mutuality between the therapist and the client. A focus on strengths and reformulated definition of psychological distress. So my understanding is that feminist therapists have been sharply critical of the DSM-4. Basically, that the diagnoses are based on dominant cultures' view of normalcy, and that they do not account for cultural differences. So feminist therapists refer to distress rather than psychopathology, and they use diagnostic labels quite carefully, if at all. They believe that diagnostic labels are severely limited for a couple of reasons. First, that they focus on the individual symptoms and not societal factors. Second, they are a part of a system that was developed mainly within psychiatry, and that it reinforces dominant cultural norms. Third, that they may reflect the inappropriate application of power in the therapeutic relationship. Fourth, that they lead to overemphasis on individual solutions rather than social change. And last, that they have the potential to dehumanize the client through labeling. Feminist therapists believe that if contextual variables are considered, symptoms can be reframed as actual survival strategies or coping skills rather than a pathology. So an example that was in the book was that a client who is a survival of childhood sexual abuse may present with disassociation, which is understood as a way of coping in order to survive as a child. And last is that all types of oppression are recognized. So it's basically that clients can best be understood in the context of their social cultural environments. Feminist therapists should be able to acknowledge that society and political contexts have a negative effect on all people. They should want to work with individuals to make changes in their lives, but also should be committed to working towards social changes. Some of the goals of the therapeutic process are listed on the screen: to provide empowerment, awareness of the client's gender role socialization process, change in the environment, to evaluate the impact of social factors on their lives, and to have behaviors that are freely chosen. A key goal of the feminist therapy is to help individuals to view themselves as active agents on their own behalf and also on the behalf of others. At the individual level, they should work to help individuals recognize and embrace their own power. And they should help individuals come together to strengthen collective power. They want also clients to be able to free themselves from the constraints of society, gender roles, socialization, other types of oppression, sorry. Feminist therapists should want to aim to empower all people to create a world of equality. Some more goals of the therapist should be to have their client gain a sense of personal and social power, to recognize the power of relationships, for the client to trust their own experiences and choices, for the client to identify messages of oppression and replace with positive beliefs of themselves, and to also understand how societal beliefs can influence them in negative ways. Feminist therapists should believe that their clients should be treated with respect. They should also value being emotionally present for their client. They should want to model proactive behaviors and be committed to their own consciousness raising process. Feminist therapists actually share common ground with Adlerian therapists, with an emphasis on social equality, and along with existential therapists who look at therapy as a shared journey for both the client and the therapist. A basic trust in the client's ability to move forward in a positive, constructive manner is also another common ground between the two. Feminist therapists also share ideas with postmodern therapists because of their emphasis on the politics and power relationships in the therapy process and a concern about the power relationship and the world in general. As far as clients are concerned in feminist therapy, they should want to be a partner in the therapeutic process. It is very important for them to tell their stories and give a voice to their experiences. They are the ones that determine what they want from therapy because they're the experts on their lives. They also need to be prepared for major shifts in their view of the world, changes in the way that they perceive themselves, and their interpersonal relationships. Some of the techniques and strategies that a feminist therapist will use are empowerment. Empowerment is at the heart of feminist therapy. Feminist therapies work in an egalitarian manner to use empowerment strategies that are tailored to each client. Self-disclosure is often used when it is in the best interest of the client to equalize the client-therapy relationship. And also the counselor can engage in self-disclosure if they feel it will be helpful to the client. Gender role or social identity analysis is that the therapist assists the clients in identifying the impact that their own gender socialization has played in shaping their values, thoughts, and behaviors. The goal is actually for the client by the end of therapy to adopt a realistic and affirming internal message about his or herself. Gender role intervention. The goal for this is that the therapist will provide the client with insight into understanding the way social issues have affected him or her. Power analysis refers to the range of methods aimed at helping clients understand how unequal access to power and resources can influence personal realities. So then a therapist and a client will analyze different forms of power in dominant and subordinate groups, which limit self-definition and well-being. The goal by the end of therapy is that the client will learn to appreciate his or herself as they are, regain self-confidence based on their personality attributes, and to set goals that will be fulfilling to them within the context of their own cultural values. So, bibliotherapy is another technique that is used in feminist therapy. This would be nonfiction books, psychology and counseling textbooks, autobiographies, self-help books, films, novels, can all be used as resources. And basically, it would be that the client would be able to read possibly memoirs written by someone who had had a similar situation or related identity, that would be able to provide them with examples of empowerment and how that they can facilitate growth. Next, we have assertiveness training, which is basically teaching and promoting assertive behavior to clients, who then can become aware of their interpersonal rights, transcend stereotypical gender roles, change negative beliefs, and implement changes in their daily lives. The therapist and the client will consider what is culturally appropriate, and then the client decides when and how to be assertive, which balances the potential cost and benefits of assertiveness within the ecological context relevant to the client. The goal at the end is that through learning and practicing assertive behaviors and communication, the client will increase his or her own power, which will then potentially cancel out any depression or anxiety. Reframing and relabeling. Reframing is applied uniquely in feminist therapy, and it is a shift from placing the problem internally or blaming the victim to a consideration of social factors in the environment that have contributed to the client's problem. Relabeling is an intervention that changes the label or the evaluation that is applied to some behavioral characteristics. So an example might be that you encourage a client to talk about him or herself and feel like a healthy person and strong person, rather than, if they're talking about themselves, being considered selfish. Next is social action, which it's typically asked for clients to do this after they have become pretty grounded in their understanding of feminism and in the counseling process. At that point, a therapist may suggest that they become involved in activities such as volunteering that could be important to them, such as rape at a rape crisis center, providing the community education about gender issues, working or volunteering at a domestic violence shelter, anything that could potentially be important to that particular client. Participating in these type of social activities can empower the client and help them see the link between their own personal experiences and the social political context in which that they live. And last, for techniques and strategies for the feminist therapy, would be group work. Therapists will often ask or encourage their clients to make the transition from individual therapy to group therapy, and it's would be a type of support group that would help them with the things that they have been dealing with. There's been literature that actually reveals that women who join these groups eventually realize that they're not alone. They feel validation for their experiences because they've participated in these groups. When they participate in these groups, their feelings of isolation begin to decrease. They are in an environment that encourages them sharing experiences, and they no longer feel alone. They feel valued and affirmed. Clients who participate in these groups often begin to feel a transformation of growth. They feel that they have support and nurturance, and then they can also feel that they are able to help and engage in the healing process of people who have experienced similar issues. One last thing that I would like to mention before I close up my presentation on feminist therapy is that men can be feminist therapists, and that feminist therapy can also be practiced with male clients. In the beginning, originally, all the feminist therapists were women, but now there are men who have joined the ranks of being a feminist therapist. Also, any presenting issue that a client could come to you with, male or female, can be dealt with from a feminist perspective. So with that being said, now that I am wrapping up my presentation, my last question for you is feminist therapy just for women, or can it be beneficial to any client? I do hope that this is one misconception that I had prior to learning about this theory that I've cleared up for you. Thank you for listening. I hope you enjoyed.